Welcome to the Color of Influence podcast, where you will hear conversations from influential people of color from around the world, from social media, and right here in your communities. These behind-the-scenes conversations will motivate you, inspire you, and encourage you. I am your host, Aisha Morgan, and let's meet today's guest. With the overturning of Roe v. Wade, women's reproductive rights are at risk. I am a big advocate for women deciding what happens to their bodies. However, depending on the state that you live in, the government may have a huge say in what happens to your reproductive system. Today, I get to sit down with Dr. Garrett to talk about different reasons why women may need to get an abortion. Yes, unwanted pregnancy is one of those reasons, but there are also some medical reasons why women may need to get an abortion, and Dr. Garrett is going to talk to us about some of those reasons today. All right, welcome back to the podcast. I am here with Dr. Angelica Garrett. We are going to be talking about this Roe v. Wade case and what exactly it means for women's health. So, Dr. Garrett, can you go ahead and introduce yourself, and we're going to get right into our conversation.
Sure. Hello, everybody. I'm Dr. Garrett. I am currently an associate professor at Meharry Medical College in Nashville, Tennessee. I did my residency training at Mayo Clinic in Rochester, Minnesota, board certified OBGYN.
And where are you located right now?
Nashville, Tennessee.
Okay. So as everyone knows, we are actually recording on August 25th, and today Texas and I believe Tennessee implemented their laws for abortion today.
Trigger laws. Yes, the trigger laws went into effect.
So can you explain what that means to us for as far as like those two cases? What does that mean?
So I'd have to look for what it meant for Texas, but I'm sure it's similar to Tennessee. But basically, it limits the ability to have a termination after 6 weeks, which most women don't even realize that they're pregnant at that time. And it puts it under the caveat of life-saving conditions would be acceptable. So let's see, like a ruptured ectopic pregnancy, something along those lines would be able to be terminated, but you cannot freely terminate pregnancy regardless of fetal anomalies or incompatibility with life after 6 weeks of pregnancy. And for those of you who don't know, a lot of the development doesn't even occur until well past that 6 weeks.
Yeah, and Texas is the same. But they've kind of upped the ante a little bit, where they also have it where if you take someone to get an abortion, or if you actually are the doctor who does the procedure, you could be arrested, but it's a civil case. It's not a criminal case.
Right. So that's where we're at here at Tennessee as well.
Yeah. Okay. So in general, what does it mean if all states ban abortions?
Well, so the good thing about our government, I say there is, red and blue is never going to ban abortion. It would take a lot for a blue state to ban abortion. But what it does is those red states, it makes the care extremely limited for people living in a red state. And it overpopulates or makes the clinic and the providers who do the abortions in the blue states overwhelmed with the amount of patients that may come in. And so you're talking about basically hopping state to state to be able to get the care that you need to terminate a pregnancy. So for Texas, California would be where you'd be headed out. California, Tennessee, we're looking at Illinois. So it's a great map that if you ever wanted to Google on Google, that just shows where the abortion right stands, and you can see where's red and where's blue, and basically all the women are going to have to travel to blue to get the care that they need.
Yeah. So one of the things that I really wanted to talk to you about, because when people think about abortions, they always think about incest, they think about rape, they think about, situations where people were forcibly involved in sex.
Mm-hmm.
But in real life, there are different reasons why women get abortions that have nothing to do with being forced into intercourse or, just an unwanted pregnancy.
Right.
So, can you talk about some reasons why a woman may need to get an abortion after 6 weeks?
Well, obviously it's choice, right? If you don't desire no longer to, expand your family, that's the number one. It should be your choice to decide to do that or not. But it can
Right.
be maternal health indications. For example, a patient may have, lupus, and getting pregnant with a lupus condition could be life threatening to the patient, the
Right.
pregnant mom. We can think of things like certain heart conditions in a mother would make them a poor candidate for pregnancy. Um, and then when you talk about later abortions, that's about, things that are in fetuses that are not compatible with life. So you talk about the different trisomies. Everyone thinks of Down syndrome, but that's not, that's compatible with life. But we're talking like the trisomy 13 and 18. Those babies tend to, maybe live, a week or two after delivery.
Mm.
Fetal anomalies where, the brain may have not developed. That's called anencephaly. So that baby cannot survive outside of the womb. So
Right.
to make a mother carry a baby to term to deliver, for it to not even take a breath outside of the womb, is what we're
Yeah.
looking at with these new laws.
Right. And definitely, I mean, when I was doing my chemo, that was one of
Right.
the things she told me, that there is no way that I could get pregnant. So I had to take whatever precautions I had
Right.
to, because
There's
I
no way she
couldn't.
wanted you to get pregnant, because you could definitely get pregnant while you're on chemo. She didn't want you to get pregnant.
Right.
Yeah.
Yeah, exactly. Because I would have to stop treatment
Yep.
for
Because the
the whole
chemo
term
cells
of my.
they attack all, the chemotherapy attacks all good cells. So that's your fetus as well.
Yeah. And I actually had to have an abortion. I didn't know that I was getting an abortion because they kept saying DNC until I went to the hospital, and the billing department kept saying abortion to me. And the lady was like, no, it's the same exact thing on your billing code. So it's still considered an abortion when you process it through your insurance. So I guess it's like something with the codes is the same.
Well, so a DNC is just that. That's a DNC could be for an unwanted pregnancy termination. It could be for a pregnancy, that a miscarriage that you can't pass, without, some type of help, because sometimes
Right.
all miscarriages you can spontaneously pass. So the DNC is the procedure, and it's done for either or. So it's billable.
Oh, okay, got it.
That's
So
what
the
it's called.
procedure is called a DNC.
Yeah, dilation and curettage. It could either be suction curettage, which is what most people are familiar with, that we insert, tubing and suck out the pregnancy, whether it be past like a miscarriage,
Yeah.
or live like a elective termination. So
Okay.
the procedure is the same.
Got it. Okay. And in my situation, it was a miscarriage with my fibroids. She didn't want it to sit because she wasn't sure if it was gonna pass.
Right. So yeah.
Um,
So
yeah.
you had the procedure,
Mm-hmm.
but it was under the caveat that you already had a missed abortion, or a miscarriage.
Right. Okay.
So I think that's where people, and when government should stay out of women's health and our lane, because the things that are terminated, it's the word abortion is used to describe pregnancy loss. So example, a spontaneous abortion is what women go through who have miscarriages, who they have
Right.
a heartbeat at one visit, and the next visit they don't have a heartbeat. A missed abortion is what we describe as the baby has passed inside, but you haven't passed past the baby. You know, an incomplete abortion is when the baby, you know, had passed inside, but it's on its way out. So we use that term to describe all type of pregnancy loss, how it gets confusing and messy when you think about the words abortion and Roe versus Wade.
Right. And I think that that is important, that for everybody to understand, because, you know, people who are against it, the first thing that they say is, well, you shouldn't do things that are going to cause you to get pregnant if you don't want a baby. But there's a lot of people who want kids and have to get abortions for medical reasons. Mm-hmm. You know, I had a friend that had, I don't know what it's called when the baby's in your fallopian tube.
Ectopic pregnancy. Mm-hmm.
Yeah. And so she had to get it removed because it wasn't viable.
Right. It would kill her if it continued to grow in the skinny fallopian tube that's maybe like a centimeter in size. Mm-hmm. It would rupture and cause her bleeding that she could bleed out and lose her life. So those are the situations that the red states are allowing the physicians to perform the procedure on.
Okay. Now, today I saw on the news that they were saying, even in those situations, the doctor has to defend themselves in Tennessee and in Texas to say why they decided to do these procedures. But as a doctor, like, how do you defend that? Because one of the words that he said was possible life-threatening is the wording for ours in Texas. So how do you tell, like, if you're on the stand, I mean, what are you saying to them?
See, that's a difference between medical knowledge and political knowledge, because every OBGYN knows that an ectopic pregnancy is life-threatening, period. Because if it ruptures and breaks the tube, the woman can bleed to death and die. So that is all you would have to say on the stand. And who's going to sit and wait for it to spontaneously resolve when the likelihood of that is slim? So even still, you have to do something to eliminate the pregnancy in the tube. So if and when I'm faced with that decision or that I guess scenario, well, I guess I just had an ectopic the other day. Oh, it was before the trigger low, but I will definitely, you know, stand on my ground like that. And then the thing about, you know, courts and stuff, you bring in people that are knowledgeable of the career, so like expert witnesses, and that's what OBGYN will get on the stand and say.
Yeah. Are there situations
that go that far?
Right. Are there situations that you can foresee that could be an issue where it's like you're making the decision to save the mom, but there's a possibility that she could have been okay, where where it would be a situation where you're really grappling with yes or no to give her an abortion?
I think that's mostly the ones that with medical reasons. So like I told you, a patient with like lupus or heart conditions, or a patient who may have a new diagnosis of cervical cancer first, for example, and the treatment would be radiation to the cervix, and if there's a pregnancy in there, that's going to terminate the pregnancy. So when you think about when they say abortion, would that then fall under the category of an elective abortion because the mother's, deciding to undergo cervical cancer treatment and the radiation will kill the fetus,
Right.
So life then is who's going to be deciding, what she should do.
Yeah. And that is tough because technically it would be, she would have had an abortion, or the pregnancy would have been terminated regardless because of the type of treatment that she was going to have.
Right. And the new problem is that when politicians write medical laws, is that they are trying to say that an IUD is an abortion factor, and it's not a device. That the IUD does not cause abortions. We can use a specific IUD, the copper IUD, to prevent unwanted pregnancy, just like you can use Plan B or even birth control pills. But if a pregnancy is going to occur, the IUD is not going to stop it from occurring. But that is now the thing that are concerned about removing good birth control like IUDs from the accessibility of patients because of these new laws.
That is crazy. So they're not going to allow to have them, and if they have them, they may have to have them removed.
Right, depending on your red state and how they define the use of the IUDs.
That is crazy.
Mm-hmm.
And then the other thing too, along with that, they're trying to get rid of access to birth control, right? Like that was the next debate.
That's the next thing. So that's the next thing, is to eliminate the accessible, free access to birth control. But again, birth control does more than just prevent pregnancies. For example, a patient who has endometriosis, which is, those are characterized by painful, heavy menses. How we control that? We give birth control pills, because that decreases the blood flow, decreases the amount of menstrual flow, decreases the pain. And it is, yes, preventing pregnancy. The treatment choice for a treatment of endometriosis is birth control.
Right.
You can look at other situations where, other heavy menstrual bleeding episodes, we prescribe IUDs for that. So birth control is just not all about preventing pregnancy. It's a health concern.
Right. And I know that when I had my fibroids, she told me that if they were going to continue to grow, that would be a possibility too, to help. I don't know, like the whole process, but that was one of the.
So fibroids, the birth control would help decrease the amount of estrogen that is exposed to the fibroid, so the fibroid won't grow. That can help you from not having to undergo a surgery to remove them. So, it's a more conservative management but saves you from going under anesthesia for a myomectomy that could then lead to other complications like bleeding, infection, damage to surrounding organs. So to prevent that step, she would want to try birth control. And that's very reasonable. And that's what most OBGYNs would start with. The duty is to not put a patient on the table for surgery if we can help them another way.
Exactly. And the costs. I mean, I just know people who have had those procedures done, and the cost is astronomical, because you're also paying the surgery staff. So it's not like
you're paying everybody. You're paying the hospital fee. You're paying the anesthesiologist. You're paying off a piece of equipment, instrument, suture, knife we use. You're paying for my time. It's very expensive.
Yeah. So it's almost like they're forcing us to go into debt with medical bills by taking away things that can prevent these surgeries from even happening.
Right. And let's not talk about, unwanted pregnancies and then the baby, and then there's no assistance after, So that's why, a lot of people say, people are not really pro-life. They just want you to have pro-baby, because pro-life would be helping sure these women can provide for these children outside of the womb.
Yeah. And I mean, in Texas, there is no paid maternity leave. So when you get pregnant, if you don't have days, you're either on disability or you just do FMLA to save your job, but you're not getting paid. Mm-hmm. So, I mean, I was blessed to have my daughter during COVID because we were working from home. So they allowed me to, not use any of my days and have a doctor's note that just said that I could still work remotely, right after Kingsley was born. So otherwise, I would have been out days, and then now I need those days because I'm going to have surgery. But it's crazy. Like there's nothing for us.
Tennessee is similar. When I had my second daughter down here, I had to use my sick time, my vacation days, and then my disability to, make pay for, get, a paycheck. So it's not the United States is not friendly for mothers to have babies, or even, fathers, paternity leave. We're not a pro-life place. We're just
No,
have this baby place.
exactly. And it's crazy because, you know, even in Texas, like our foster care system is terrible. We have so many kids, like working in the education system. There are so many foster homes around our schools.
Mm.
And these kids is just like a revolving door of them just getting moved in. Then they're going to another school because they get sent to another one, or they try to go back to their parents and can't, or it's sad. And the kids are the ones who suffer.
Yeah.
And it's almost like they forget that these kids become adults. So, you know, their futures are really going to be tough just based off of how they came into this world.
Yeah, you're right. But some would rather this them come into the world than, you know, help them live in the world.
Yeah.
And you may not know, but our governing body, so American College of Obstetrics and Gynecology, is based in Dallas. And every few months, newly trained OBGYNs have to travel to Dallas to sit for their oral boards to be board certified. Well, the OBGYNs are, protesting our own group to move our headquarters out of Texas.
Yeah.
Clearly a state that is not friendly for women's reproductive rights. So it's a battle in our own. But this year, they're not bringing the doctors down to Dallas to take the exam. They're doing it virtual. So that's a step in the right place. But yeah, so it's like, I don't want to give my money to a state that doesn't honor women's health rights. And abortion is healthcare.
Yeah.
Because I'm concerned that people are going to start coming through the emergency department with, their yard abortion. And what does that mean? That means, getting a wire coat hanger, heating it up with a lighter and inserting it through your vagina, through your cervix, trying to rupture the sac of water where the baby is. And that you can already imagine the detrimental effects of that: infection, bleeding, death, right?
Yeah.
So if you're desperate, if you're not able to cross state lines to get to another state, a friendly state that can do the procedure, I mean, there's laws that are already set that you have to wait, 48 hours before you can get the abortion anyway. It's like, kind of like rethink it law. So just imagine that. So that's what I'm afraid is going to, start happening. I haven't seen that in my lifetime, but my partners who are older than me and have been in this game a long time, they were around when that was happening. So they're going to see that all over again.
And that's so scary, and it's useless. It's unnecessary. And, I don't understand why women are not considered citizens and people, and why we have zero rights. And I mean, it's insane. And I don't, you try to think of the positives of living here, like in this country. And obviously it could be worse. I mean,
yeah,
but there are some third world countries that allow abortions for free.
Right.
Because you think about it, if you're constantly having kids and we're already a country that is poor, and you're study having kids, that's not going to help us in any way.
I would advise anyone, if they have time and are interested in this, to watch Roe v. Wade on Netflix. And it shows you why, the abortion laws are the way they are, because it's all about money, medical access, and gain. It has nothing to do with women's rights or women's health care. It's a very eye-opening documentary. It's on Netflix. If anyone ever wants to dive into it, you'll see how much the Catholic Church runs the politicians in Texas and stuff, and the big spenders. You'll see. It's a really good documentary. It upset me, but it opened some light.
Yeah.
I'd say.
Now, when Biden put forth this, to overturn the the verdict.
Just so it's like, he put on paper that he doesn't support it, because it doesn't do anything.
So there's nothing like that doesn't matter that he
That
said
doesn't
that.
matter. If it mattered, trigger law wouldn't have went in. Ours wouldn't have went into effect. Like
Yeah.
it's another thing to put on paper that he wasn't in favor of this. But I mean, we can talk for days about how our government needs to be restructured. There should be no way that one person be appointed to any judicial branch or any government branch and stay there for the remainder of
Their life. Yeah.
So his band, I guess, whatever you want to call it, does nothing.
Okay. Because that was one of the things, like I follow this girl on Instagram that kind of goes through it. And that's what she was like. Yeah, he's just saying it, but it doesn't change anything. It just turns everything over to the states.
Mm-hmm.
So the federal government has no say in what happens in each state.
Yes, it just turns everything over to the states. And you're in one of those red states, you already know what time it is.
Yeah. And I mean, November is so important. I know for us, we have our lots of elections that are going to change the course of what Texas looks like in the future if we get our way. Is that the same for y'all too?
Not so much. I mean, so Nashville is the bubble of the red. So, it is.
Got it.
It's
the rest of Tennessee is not on board.
It's the bubble.
Yeah.
But I mean, I'm not trying to discourage anyone in Tennessee from voting. Clearly vote, but it's the bubble of the red.
Yeah. And I think for us, because we've had so many transplants come to Texas, that might be our saving grace. I mean, there are tons of people from California moving because so many businesses and companies have moved their companies to Texas for the cost. So, like we have Tesla. I think that there's like some other companies that were in California that are coming to Texas. Just a lot of people are moving their businesses here in general, just because of the cost. We don't pay state taxes. So it's a great opportunity for businesses. So, I mean,
y'all get rid of Ted Cruz, y'all are on the way.
Yeah. And I'm hoping and praying. And right now, Beto is looking really good. I mean, when they do those little polls and stuff. So fingers crossed. Yeah, that's true.
Hillary up, polls had Hillary up, and then the election night.
That's a whole nother conversation because this electoral and popular, I can't get down with that.
I don't. It's ridiculous.
I don't understand that.
It's not, government is not set up for the people.
Right. I mean, and I understand why people are like, my vote doesn't count, because in a sense, sometimes it doesn't. Depending on where you live.
I know.
But
it's depressing.
It is. It's sad. So going forward, though, what is something that women in these red states can do? Like, is there conversations they should be having with their doctors? Right now, we have access to birth control. So is that something that, more conversations that we need to have? What do we need to do?
Right. So for me, any patient I see now, the conversation is always about contraceptive and what are your desires for a future pregnancy? If you today, how would you handle it? Right.
Yeah.
Because you have to put that in perspective. And, it's talking about long-term contraceptives. So IUDs, implants. So, the IUD, we have some that range from 5 to 10 years, the next one on, which is the insert that goes in the arm, that can stay for 3 years. So my younger, like about to go to college students, I focus really much on that long-term contraceptive.
Yeah.
But it has to be a conversation that I would hope as OBGYNs, we are starting patients, but if not, advocate for yourself and say, hey, what things are available for me? Because you don't want to be caught in a situation that you could potentially control. So we can't kind of control pregnancy if we are on appropriate contraceptive.
Now, in the event that someone, you know, feels like they may be pregnant, or because I feel like, I don't know, just having, it's weird to just be sitting there with a bunch of pregnancy tests. Like,
I know,
let me hurry up and take this test. Like, I don't know if I'm pregnant or not. And I mean, is that something that people should do though? Because
it's the problem with that is this, because pregnancy determination is a missed menstruity, is a missed menstrual cycle. That's 4 weeks, right?
Yeah.
So if you know, and some women are like, oh, well, sometimes I'm regular, sometimes I'm irregular. Like, so it puts a lot of stress on a woman to know her cycle like clockwork. And not all of us can say, yes, my cycle comes every first of the month. It doesn't work like that. The body is made to work like that. You know, you could be in a stressful situation at your job for a few weeks, and that changes your whole cycle. You know, so that's why I'm pushing, you know, birth control. If you know that you do not have any desire to be pregnant in the next 1 to 2 years, 3 to 6 months, let's try to prevent that, so we are not rushing or trying to ship you to another state to get the care that you need.
Yeah. Now, what do you think about these apps? Because now that's the thing. Like, I used to use Flow to track my period when I was trying to get pregnant. And then I used it after, not as consistently, I meant. But like, I was using that app for maybe like 5 or 6 years when it first came out till I got pregnant. But they're saying that information is going to be used against women to see if they've had abortions or not.
I think I've read something that it has already been used against a woman in a state somewhere. So you don't need the app, right? You don't need that. You just need a calendar.
Exactly.
Go back old school. Take a calendar. You know, we all use planners. You know, I think people still use planners right in there. But you know, it's too many. I'm not trying to be a conspiracy theorist, but it's too much access to the phone that exposes you to, you know, other things. Clearly, you know, you could be looking on your phone, you could be looking up something about you could be talking about a shoe that you liked. The next thing you know, you open your phone and you see the shoe, right? So I mean, I'm not trying to be that theorist, but don't use the app. You don't need the app. That we don't have to depend on electronics like that. It's just simple as a calendar, and you writing that, oh, my period happened right there. Most women ovulate between day 12 and 14, so count it out, you know, and then see where you fall. You don't need that app.
Which is good advice, because like, even for me, like, once I saw that, like, I don't think about those types of things. I just put it in there, and you know, it's the convenience of it, not realizing that later on, like, this could be used for whatever reason. I mean, so it's sad. I mean, I feel so bad for like our daughters, because it's going to be a lot happening. You know, if things are not changing, who knows what they're going to be dealing with by the time they're our age. Like, it's crazy.
I already know what I'm doing. My daughter, first period, boom, birth control.
I mean, it's crazy, right? I hope the world is better for them, but you
not
just
the rate
never
it looks
know.
like we're going, huh?
Yeah, you just don't know. But Dr. Garrett, thank you so much for coming on.
Thank you for having me. I made it. I made it. Mama, I made it. I made it on each podcast.
This was good information, because I really think that a lot of people don't understand like what is all entailed in an abortion, why women get them. It's not just about unwanted pregnancies and, you know, being molested or raped. There are lots of medical reasons why women need to get abortions, just to save their lives. And sometimes it's to have a better quality of life for that child. Like, we know that if it comes into the world, it will not have an extended life or a life that anyone, full of medical appointments because of the things that happen in what do you call it? In vitro?
Yeah, no, you're right.
Yeah.
I guess my final sum it all would be, you can be pro-life, pro-choice, but it should always be the woman's choice. Like, you can have your view as pro-life, I can have my view as pro-choice, but if it's me sitting in the chair, I should be able to determine what I'm going to do.
100%.
And that's how I feel about all healthcare. We're not walking around telling men to snip it up, right?
Right.
Okay.
Exactly.
That's my closing.
Yes, which is a good closing, because when they start putting vasectomies on the table, everything's about to change.
What you said.
Everything. All right.
Take that Viagra away, then it's really going down.
Exactly. Yes. Sure enough. All right. Thank you again, Dr. Garrett.
Yes, thank you so much for having me.
All right. Bye.
Bye.
And that's a wrap on another amazing episode. I know that you were just as inspired as I was after listening to that conversation. And to let us know how we're doing, don't forget to leave us a review, like, share, and subscribe to the podcast. You can also follow us on all social media platforms, from YouTube to Facebook, at The Color of Influence, and on Instagram, _color_of_influence. You can check out all of our episodes and additional content on our website, thecolorofinfluence.com, and that's an N only for influence. And don't forget to share the podcast with someone you know, and have them share the podcast with someone they know. Thank you all for listening. Until next time, peace out.